welcome to IRACON 2023. This is Dr.Shounak, ghosh, a rheumatologist from Calcutta, and it is my great honor today to welcome and to take a short interview of Professor Aman Sharma, Professor of the Department of Clinical Immunology and Rheumatology at PGI Chandigarh. And sir, a huge congratulations to you for becoming the President-elect of the Indian Rheumatological Association. Right off the bat, I would like you to give us some insight about your visions as the new President of our association, sir.
Thank you, Shounak, for inviting me to be a part of this interview, and also for the congratulations. I would thank the Indian rheumatology community for choosing me to lead the IRA for 2 years. I'm looking forward to my tenure. I've been associated with IRA since last 11 years consecutively in the executive committee. And I've seen the change, the quantum leap which IRA has taken over the last decade or decade and a half. And if I could say, these are the exciting times for Indian rheumatology. In all domains of rheumatology, when we talk about patient care, when we talk about teaching, and when we talk about research, all three, there has been a substantial, palpable improvement. I mean, if you see that so many teaching centers have come up, the number of the seats for super specialty training have gone up exponentially. We now have close to nearly 100, we are almost touching 100 DMD seats in a year. And with the students passing out from various institutions, having trainings, they're spreading out across the country, and they are providing those clinical care facilities to all the patients who are in dire need. We know that the burden of the disease is enormous. And as far as research is concerned, you will see that Indian rheumatology is being recognized. I know my tenure in the American College of Rheumatology from 2015 to 18 was probably a sounding board that the Indian rheumatology is coming in a big way. So now if you see the presentation in the recent ACR, our people have platform presentations, the plenary presentations, so many oral presentations and poster presentations. This showcases the quality of research being done. I've myself been a part of, you talked about vasculitis. I've been a part of the vasculitis research groups. So I think these are exciting times for Indian rheumatology.
Right.
And I would...
About vasculitis, so you are a prolific researcher in the field of small vessel vasculitis. You in fact have a debate coming up today as well. Very exciting. So what are some of your insights on the recent advances in the field of managing small vessel vasculitis?
I think if you look at the last 2 decades, we initially had just one good drug for induction. Then now we have one more, which is always a welcome. And then we have trials tailoring the maintenance regimes. As far as Plex debate is concerned, I'm very much looking forward to that debate. And the organizers and the scientific chair asked me to debate with my very dear friend, who happens to be my partner in crime, as I may say. So I won't let the cat out of the bag as of now. But I would say that there is a role of Plex, and I will convince all of you that you will all do Plex in difficult pancreavasculitis. There are various researches being done in different types of vasculitis. The other thing which is very close to my heart is DADA2, where the adult DADA2 patients, the numbers are just exploding. In the last week or so, I've just seen 2 patients. They present with stroke, they present with GI bleed, they present with perforations. So we are duty bound to pick them up, because it's a difference between life and death. So that's another new thing which has come in vasculitis. Of course, we have VEXAS syndrome. I'll talk about VEXAS when I talk about relapsing polychondritis on Sunday. We've seen patients of RP and VEXAS. So we've seen VEXAS with gout. We've seen VEXAS with sweet syndrome. So it's not that it's not there. It's there. We just need to pick it up.
Right. So thank you so much. And final question, you're also chairing the SIG on Indian Journal of Rheumatology editorial board.
Yes.
So for young rheumatologists wanting to get ahead in the publication curve, what are some of your advice?
I think all domains improve, and they move hand in hand. So as I say that good research is being done, so that research will percolate to IGR also. And I would welcome submissions from all the young researchers who are doing exciting research to IGR. One good news is that 2 changes that I have been working on, and we are going to bring from January, is that we've changed the publisher. And also we changed the submission system. The submission platform with the previous publisher was an issue. So we're going to manuscript central publishing system. And also we're moving to Sage publishers. So that which has already been contracted. And we have the quality of submissions since I was associated with Journal Against for almost a decade or more. So the submission quality has also gone up. We got the first impact factor last year. So we have some indexing, and we're looking forward to the PubMed indexing. And then obviously it will take off once we have that. My efforts will be towards getting the journal PubMed indexed. And I think we can do it. And I will invite all our young colleagues and all our big time researchers to submit their research to IJR.
Thank you so much, sir, for your time. So
thank you for having me here.
Signing off for IRACON TV.